I want to share a very special test item cluster with you today, and that is a test item cluster for mechanical neck pain that benefits from thoracic manipulation. First, the patient must have an FABQ score of 12 or less, symptoms lasting than 30 days of duration. They must also have reduced kyphosis of their thoracic spine, no symptoms distal to the shoulder, and looking up does not cause any pain. Look up for me. Any pain? Nope. The last part is they must have less than 30 degrees of cervical extension. So let's take a quick measurement of that. Robert, I want you to look up for me. 23 degrees. Perfect candidate for some thoracic manipulation. Whoa! I heard you want to learn some test item clusters for a full thickness rotator cuff tear and sub-acromial impingement. You, my friend, are in luck today. First, let's start with some test item clusters for a full thickness rotator cuff tear, starting with the infraspinatus test. Robert, bring your hands like so and resist me coming in. Move. Positive infraspinatus test on the right side. Next, we're going to perform the painful arc. This one, I want you to bring your arms all the way up. Ouch. And all the way down. Ouch. Is that your pain? Yes. Painful arc, positive on the right side. Next, I want you to bring your arms up for me. There you go. Bring them up, 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 up. Now good. From here, I want you to drop them down nice and slow. Positive drop arm on his right side. Next, we're going to cover the test item clusters for sub-acromial impingement. Starting with, you got it, the infraspinatus test. Hands here. Resist me coming in. Positive infraspinatus test on the right side. Next, let's perform a painful arc. All the way up. Ow. And all the way down. Ow. Positive painful arc on the right side. Next, we'll perform the Hawkins-Kennedy. Ouch. Is that your pain? Yes. Positive Hawkins-Kennedy. I will be performing the test item clusters for mechanical neck pain that may benefit from a cervical manipulation. The first item in the test item cluster is if the patient feels like a cervical manipulation will benefit them. Do you feel like a cervical manipulation will benefit you? Yeah. The second item is if it's been less than 38 days of onset. When did your pain start? Yesterday. Wow. The third item is if they have more than 10 degrees side-to-side difference with cervical rotation. I'm going to have you rotate your head to the right. Okay. Bring it back to the middle. And now rotate your head to the left. Perfect. The last item I'm going to have you get on your stomach is if they have pain with PAs in their cervical spine. Ow! We're going to go over test item clusters for cervical radiculopathy. Starting with checking the patient's rotation. So Robert, I want you to look and rotate to the right for me. Good. Just come back to midline and rotate to the left. So he was positive for having less than 60 degrees of rotation in their cervical spine ipsilaterally. Next, we're going to perform the Sperling's test. So I'm going to apply some compression through the head, through the cervical spine, to see if it reproduces his symptoms. Any pain? No. Good. Next, we're going to have him extend and look up towards the ceiling. So please look up towards the ceiling. And I will still apply that compression down through his head. Any pain? No. Okay. Let's have you look to your right while still looking up. And we'll apply that same compression again through the head and the cervical spine. Yikes. That hurts. All right. So he is positive for a Sperling's test. Next, I'm going to ask the patient to kindly lie on their back. Here, I will perform a distraction to see if it alleviates the patient's pain. Holy cow, that relieved my pain. And they are positive for a distraction. The last and fourth item in the test item cluster for cervical radiculopathy is going to be an upper limb tension test. Yikes, that hurts. And they are positive for a reproduce their pain. 1001, 1002. Oh hey, didn't see you there. I don't know if you just heard me counting, but I just did over 1,000. Right now, I'm about to perform a biceps load test. All right, Robert, I want you to pull this hand in towards your face and resist me. Ow. Is that your pain? Yes. Test is positive because it reproduced the patient's pain. Next, I will perform the upper limb tension test.
Ow.
Is that your pain?
Yes.
Are you positive?
Yes.
I will be performing O'Brien's test, also known as the active compression test. Robert, can you please extend your arms out like so, thumbs down, and bring the hands as close as you can together, and I'll apply some pressure at the end.
Ouch.
Is that your pain?
Yes.
Where is that pain?
Deep in my shoulder.
Okay, let's do the same thing again, but thumbs up this time. Okay, good.
Ah.
Is that your pain?
Yeah.
And where was it?
Same spot, right deep in my shoulder.
Was it any better that way?
Yeah. But it still hurt.
I'll be performing the sharp parser test, where I will be taking my right thumb and placing it on the patient's C2 spinous process and my left hand on their forehead and ask the patient to flex their neck forward. Good. Oh, Robert, why'd you have to die on me?
I'm not dead, you silly.
Robert, you're alive!
Heck yeah! I heard you needed help on your physical therapy project.
Yeah, let's do a cervical flexion rotation test.
All right.
I'm going to start off by having you do a deep cervical flexion and rotate you first to your right and to your left to see if there's any limitation at the C1, C2 segment. Oh, Robert, you're dead again! I'm about to educate you on a differential diagnosis between a full-thickness rotator cuff tear and a C6 radiculopathy. With C6 radiculopathy, the patient will have no pain with movement. They will also have decreased reflexes at C6 and decreased sensation at the C6 dermatome. Jenna, close your eyes and let me know if you feel anything.
A little. Yeah, a little.
And decreased strength at the C6 myotome with elbow flexion and wrist extension. So I'm going to have you bend your elbow here. Resist me pulling you apart. Good. Next, make a fist. Great. Pull you back and resist me pushing you up. Excellent. So there's a possibility to have diffuse weakness at the C6 level for any muscles that are innervated by C6. Next, with the full thickness rotator cuff tear, the patient's going to be positive for all test item clusters that we performed previously. And typically, muscle weakness is isolated with external rotation and or internal rotation, depending if there are single or multiple rotator cuff muscles that are involved. The most common is the supraspinatus tear, where the patient will have isolated pain over the injured site or the tear. And sometimes the pain will also be in their deltoid, specifically at the deltoid tuberosity where the muscle inserts in.